Now, one of the things we've noticed, and I know lots of other practices and doctors have noticed this as well, is the correlation of Lyme disease with mold. Mm-hmm. It seems to go hand in hand. And a lot of times it seems that almost doctors who may not know start to misdiagnose one or the other and start to treat one or the other. But what have you seen in your practice and in your experience about Lyme and mold? Are they truly just often misdiagnosed, or do they actually go together?
Great question. So I frame functional medicine in a very simple paradigm, and I think it fits what we're talking about: toxic load and infectious burden. And I think almost every chronic patient that I see, I know you're nodding, you see this too in your clinics, is a combination of toxic load and infectious burden. And how they fit together is we all have dormant infections in our system. I've never once seen a patient that doesn't have an old infection that is dormant. It's not bothering them, because 95% of college-age kids have had mono, which is Epstein-Barr. And then most of them have had some sort of HHV 6 or 7 or some childhood exanthem, like a viral infection, strep throat, et cetera. And then many people are bit by ticks, but also like things like Bartonella, cat scratches or spiders, or mosquitoes carry some of these things like West Nile. And a lot of these things didn't really, because they had strong, robust immune systems, they might have got infected, had a very short illness or some little thing or nothing at all, but they're carrying these bugs or spirochetes or viruses in their system. And our immune system is created to keep those in check. So if you're healthy, you're living well, you're doing well, you don't have a big toxic load, you might have a lot of things that are under the surface, but they never cause symptoms. They don't bother you. And that's how we're meant to live. Like, we're meant to be able to control these, not that we never get infected. But what happens in a moldy environment, many of the toxins I mentioned, especially the trichosidines, are massively immunosuppressive. There's one called mycophenolic acid that can be tested in the urine. That's usually from Aspergillus, but can be from other species. And this in particular is used to make the drug Cellcept, which is for organ transplant, to compromise the immune system so that they can, so literally they use that mold mycotoxin to cause immune suppression. It's one of the strongest immunosuppressants known to man. And I see people all the time that walk in with mycophenolic acid levels off the chart. I'm like, it's like you're on Cellcept, right? It's like you're an organ transplant. So wouldn't it make sense then, if you're completely immune suppressed, you're in this moldy environment, things that weren't bothering you, like a Lyme tick bite from 4 years old, starts to pop up, and it's truly an infection and it's getting out of hand and it's causing symptoms. But it's not just the fact that you have that infection. It's the fact that your immune system is completely not doing its job. So I always think of it in that layer too, because usually I'll treat the toxic exposure, the mold, first. And then some people don't need aggressive treatment for infections, because if their immune system comes back online, often we do both, but I usually don't treat the infection, and I don't do a huge amount with metals or that until we first get the exposure down and say, where is the immune system at? Can it come back online? Because often if we get rid of that mycophenolic acid, and that's not the only immunosuppressive mycotoxin, there's others, that's just one we know about, then they can do the fighting of the infections. So that's kind of how the common circumstance would be: someone comes in really sick. Top Lyme symptoms or the tick-borne infections would be fatigue and pain of some sort. There's many others, but those are super common. And they might have brain fog, fatigue, pain, neurological things like numbness, tingling, weakness. And I kind of try to say what's in the environment. And if there's a massive mold issue, we ignore the Lyme temporarily and support their immune system and get them detoxed. And then we reevaluate and say, okay, is the Lyme still here? And many people still need treatment, but not everybody does.
Yeah. My father was a doctor and talks a lot about this, always says, listen, you got to clean the terrain before you get rid of the mice and the cockroaches, right? Yes. You can't just set the traps, which would be antibiotics, in a terrible environment. You got to first get the environment clean, get the organs, get detox going. Then you could go in and start to address those pests, which are your Borrelia, your Babesia, everything else that usually comes packaged. It's never one or the other.
Right, exactly.